I'm Dr. Arpita Ray, Regional Lead for Bourn Hall Group in Essex, and I specialise in polycystic ovary disease and unexplained infertility. Polycystic ovary syndrome is a conglomeration of quite a few symptoms, and the way we characterize it, that if you have very high number of ovarian follicles in your ovaries, which you probably got it since your birth. There is hormonal imbalance, so there is abnormal FSH, LH level along with sex hormones as well, and the symptoms. And those symptoms could be excessive body hair, oily skin, menstrual irregularities, and high BMI. So when we get 2 out of those 3 factors, then you can categorize that woman has got polycystic ovary disease or the syndrome. For the diagnosis of polycystic ovarian disease, you need a hormonal test, you need ultrasound scan, and also assessment of the symptoms. So therefore it needs a specialist opinion to get it diagnosed. With PCOS, the fertility get affected because what normally happens in the polycystic ovary disease, that woman has got high number of ovarian reserve, high number of resting follicles, but those follicles does not get matured in time, and therefore they do not get regular ovulatory bleed. So they usually have prolonged cycle where these follicles which are immature get arrested at certain level, and therefore we get thickening of the lining of endometrium, which we will be seeing in the scan, and they will get withdrawal bleed maybe after 2 months, sometimes 3 months, and it creates this irregular cycles and no ovulation. Improving the chance of falling pregnant naturally when you have diagnosis of polycystic ovary disease, it's important to optimize your body weight, and it's proven in scientific studies that if you optimize your body weight, you have higher chance of falling pregnant, and therefore it's very important. And we encourage through our alternative expertise, like we do have dietitian, we do have healthy lifestyle specialist who can advise about the diet and lifestyle issues, and that can help a woman to optimize her lifestyle factors and help falling pregnant naturally. And quite a lot of time we do not understand that the female fertility is quite related with the female age. So if a woman become fertility aware of her ovulation patterns, are aware of her ovarian reserve, it can help them to make a definite informed choice when to start their family. So I think fertility awareness is very important when you are leading your life. You have got your plans, your goals and targets to meet, so that you can balance your work and life together. A woman can improve her natural fertility in quite a few ways. One is looking at the lifestyle factors. One of them very important is weight. We all know that weight, if it is above BMI 30, it does have impact on fertility and ovulation. We normally recommend a BMI approximately around 26. Smoking excessively does affect egg quality. Age of the woman does have its own impact on quality of the egg and the ovarian reserve, and therefore success of any fertility treatment will be affected by that. Recreational drugs, alcohol does have very bad impact on fertility treatment as well as natural fertility of a woman. And there is also issues related to medical disorders. So if you are within average weight, you don't drink, smoke, and you are living a healthy lifestyle, or you change your lifestyle within those parameters, your natural fertility will improve. BMI is important for women to be optimized. Reason for that, high BMI can disbalance the hormonal equilibrium in female body, and therefore it can lead to anovulation, prolonged period, and therefore infertility. Once you reduce your BMI below 30, this hormonal imbalance in most cases get corrected, and if that is the only reason for not falling pregnant, you will achieve pregnancy.